So it is my great pleasure to welcome Dr. Mónica Carugatti. She's been a clinical psychologist since 1980 and has worked in private practice since her degree and for 26 years in public and private hospitals in Buenos Aires. She has also studied bioethics and psychoethics, and since 2011 she has dedicated herself to studying the corruption and poor science related to ME, CFS and Lyme disease. Please welcome Dr. Mónica Carugatti.
Okay, thank you. Thank you everybody for listening to us. Mónica will do a small presentation in Spanish because she doesn't speak English, but I will translate what she says. It's a very introduction, and then do the presentation myself.
En Argentina, las autoridades responsables niegan absolutamente la presencia de la enfermedad de Lyme en humanos y animales, aduciendo que no se han presentado casos humanos, que no tenemos el tipo de garrapatas duras que se encuentran en el hemisferio norte, que estas garrapatas no pican humanos, que desconocemos si las cepas de Borrelia burgdorferi encontradas son patológicas para el hombre. No se buscó aislarla ni cultivarla. Esta fotografía, que vamos a ver ahora, esa fotografía corresponde a una paciente mordida en la costa de la provincia de Buenos Aires. Nosotros vamos a presentar una búsqueda bibliográfica en donde se muestran las regiones del país y de dos países vecinos, tres países, Chile, Uruguay y Brasil, donde se muestran las publicaciones. En primer lugar, vamos a ver que no siempre fue así. En los años 90, un grupo de profesionales de la ciudad de Rosario, que es una provincia al norte de Buenos Aires, se habían reportado dos casos de dos pacientes que vivían con perros infectados. De ahí en más empieza toda una serie de investigaciones. Paralelamente, el doctor Stanley, profesor de microbiología de la Universidad de La Plata, encuentra casos humanos positivos casi casualmente en 1993 en el laboratorio donde él trabajaba. Hay dos publicaciones de Néstor Stanley, Justo Trevisani y Serena Bonin, que son actuales, donde describen 5 casos humanos. Vamos a prestar una atención particular al Valle Yosinari Síndrome en Brasil. Particularmente interesante esta variante brasileña de Lyme que se ha denominado enfermedad de Valle Yosinari. Esta enfermedad presenta eritema migrán y también a veces eritema nodoso. El cuadro clínico es sustancialmente el mismo, pero presenta mayor resistencia a los antibióticos, es altamente recurrente y evoluciona con encefalomielitis miálgica, síndrome de fatiga crónica muy marcados. Y tiene una alta tendencia a presentar enfermedades autoinmunes. Los vectores son amblioma japonese, ricetáfulo, que es la garrapata del perro, y dermacenters, o sea que no son los mismos que en el hemisferio norte. No se pudieron aislar ni cultivar espiroquetas móviles convencionales. En todos los estudios animales y humanos se observaban estructuras inmóviles sin pared parecidas a microplasma y queamidia, pero enriqueciendo el medio de cultivo se transformaron en Borrelia burgdorferi sensu stricto. Se considera una mutación de la Borrelia burgdorferi sensu stricto para adaptarse al bioma brasileño. Bueno, el recalamiento del artículo de Yosinari Trevisani 5, porque... Bueno,
Okay, now I explained in what she said in English. So, first of all, we say we don't have any potential conflict of interest regarding this research, which was the introduction. The main problem with Argentina Lyme disease is that health authorities do not recognize the existence of the disease. We have seen that in other presentations, but in the case of Argentina, we hardly don't have doctors that we have knowledge of diagnosis. And it's very difficult to find patients because even if a patient presents the erythema migrans we are seeing, the doctors wouldn't recognize it. But even if they call the authorities, infection authorities, they would say that's not Lyme because in Argentina there is not Lyme. So Argentina does, and also they say Argentina does not have a species of hard ticks found in the northern hemisphere, so there is no possibility of Lyme. Argentinian ticks containing Borrelia don't bite humans, and we don't have Borrelia burgdorferi strains found in the country. The Borrelia burgdorferi strains found in the country, we don't have any evidence that they are pathogenic to the humans, but even if they haven't even have any attempt to try to culture it or to do research on this issue. So this photograph is a photograph of an Argentinian woman with an erythema migrans that is not recognized. So what we will learn here, we will learn that there is indigenous human patients with Lyme in Argentina, because when a patient is diagnosed with Lyme, Argentina's authorities would say that they were bitten outside the country, in foreign countries, and they came into Argentina ill. But we are going to learn that there is indigenous human patients with Lyme. There is no scientific research to support the belief that there is not. It is essential that Argentinian physicians be trained to diagnose and treat patients with both indigenous and non-indigenous Lyme disease. So our hypothesis is that there is Lyme borreliosis in Argentina in different areas of the country. The method we use is we do a research in literature. We administer a questionnaire to 11 patients that contact the Association of Patients in Lyme Disease in Argentina through social media. And at the end, patients that contact our social media, and we ask them how they were diagnosed, and we help them to get diagnosed outside the country, were included. We took the information of where they live and where they were bitten. So there was a map prepared of where they live and where they were bitten. Okay, literature research. We have plenty of research from the first one was 1980, end of 1980s, 1989 or I think, that shows that there is Borrelia in Argentina. Research is very different from one to the other. Some of them are showing Borrelia in ticks. Some of them are showing Borrelia in animals, and some is showing Borrelia in humans. We have here 4 research. 1993 was one of the first research finding Borrelia in humans in the province of Buenos Aires. And then we have Borrelia also in Salta, always 5 cases of humans. That's a very recent research. And then we have Borrelia in the North Delta that was found in roditors, and also in ticks in Buenos Aires. Argentina is very large with different climates, and so we concentrate the research into a geographical position. We position it geographically. In Rosario was the first research show in 1988 by Mazzonelli, that they found 2 patients ill with Borrelia. It was the first one to report Borrelia in humans. There were 2 ladies who lived with dogs, many dogs. All dogs died. And the research couldn't be done on dogs because both died. But then this group of researchers keep studying, always in the city of Rosario. And so we have many reports of Borrelia present in humans, animals, and in ticks. We have Borrelia in the north of Argentina, and all these studies were on ticks, and Flores found in ticks again, and animals too. Birds, well, animals and birds. We have Borrelia in Patagonia. We blended Argentinian Patagonia and Chilean Patagonia. In Chile, Ivanova did a great research in Borrelia. She found a new strain of Borrelia, calling it Borrelia chilensis, but further research needs to be done. We had a clinical doctor that we had two specialists in Borrelia, physicians in Borrelia in Argentina. Both of them passed away recently. And one of them, no, I'm here, this is Península de Valdés. Argentina has one of the main colonies of penguins. And he reported in a telephone conversation, because he didn't do actual research, that in that area he had many patients with Lyme, that the penguins were having ticks, infected ticks, but no research. We have no research on this at all. And then what my mom mentioned too, we have a great research on Brazil. We took the Brazil and Chile because we are very close, but Brazil has a really good and large tradition on research on Borrelia, and is particularly interested because there is a Brazilian Lyme variant which has been termed Jocinari disease. This disease presents the migrants, the erythema migrants, and also the erythema nodosus. And the clinical picture is substantially the same, but it exhibits greater resistance to antibiotics, is highly recurrent, and progresses with marked chronic fatigue. It also has a high tendency to develop autoimmune disease. Basho Jocinari is vectored with Amblyoma cayennense, Receptalus doctix, and Dermacenta. Conventionally, moving spirochetes could not be isolated or cultured. In all animals and human studies, immobile, wall-less structures resembling mycoplasma and chlamydia were observed. Enriching the culture medium transformed them into Borrelia burgdorferi stricter, which in Basho Jocinari appears in a typical round shape. This is considered a mutation of Borrelia burgdorferi stricter to adapt to the environment. We recommend the bibliography of the article of Jocinari and Trevistan. So what we have here is a picture of a country and surrounding country which presents Borrelia in ticks and animals, birds especially, and humans. Now we did a questionnaire to 11 people. Do you want to say something about that? She's going to say something about that in Spanish, and then I say it in English.
Sobre el cuestionario, sé que los pacientes son muy poquitos, pero es el resultado del esfuerzo de los primeros que hemos sido diagnosticados en el exterior después de años de enfermedad y diagnósticos cerrados, y que quisimos tratar de evitar que otros pasaran por lo mismo. Algunos de los datos de la encuesta se explican aquí, otros no los he procesado todavía. Particularmente interesante para mí es el caso de cefalorhinitis miálgica, síndrome de fatiga crónica, que he estudiado durante años y siempre sostuve que la presentación clínica de la fatiga de los enfermos de Lyme no difería de la que siempre se consideró de origen viral. Ustedes saben que hace menos de 2 años el Centro de Control de Enfermedades considera a la Borrelia burgdorferi como uno de los patógenos que generan fatiga crónica. Y otro aspecto fundamental para mí es la hipótesis de que la alta incidencia de ideas suicidas en los pacientes se debe a iatrogenia y abandono médico. El tercer aspecto tiene que ver con la violación de los principios bioéticos de autonomía y beneficencia por parte de los profesionales médicos. Bueno, por último, nótese que la distribución de los pacientes coincide con la zona donde se encuentra la borrelia.
And I will do that. Okay, we have this, we have applied this questionnaire to 11 patients in Argentina. We asked them what was the, apart from the clinical diagnosis, we asked all the tests they had done. In Argentina, we only have immunofluorescence. So some of them did the immunofluorescence test more than one time, several times in this case, 2 times, or add, when they have the possibility, other tests, ELISA, ELISpot, triplets, and immunoblood and Western blot. The result was that 82, so now 9 out of 11 patients were beaten in Argentina. So we do have indigenous Lyme in Argentina, 1 in India and 1 in Uruguay. The diagnosis were 100% clinical too, and difficult to find a doctor. Obviously, everybody had difficulties finding a doctor. 5 patients got the initial diagnosis by Argentine doctors. Both of them passed away. One of them was very, very young. And 6 got the diagnosis in foreign countries. They look for doctors in foreign countries, they travel, and they want to search for results. Regarding the symptoms, 9 found the erythema, the rash, the erythema migrans. 9 of them find rash, but 6 were considered analyzed and seen and diagnosed as erythema migrans. So that's why we have these patients, because they have the rash, and so they wanted to find a solution for that rash. 6 had chronic fatigue. Then they have erythema nodosus, vasculitis urticarians, and we had 6 people that had suicidal thoughts. 10 of them were treated with antibiotics. Just 1 of them felt it was cured because he was treated with antibiotics in a very initial stage of the illness when they saw the erythema migrans in it. 4 did apitherapy. One of the doctors was expert in this type of treatments. All of them do integrative therapies, different type of therapies, and 4 of them try a psychological therapy to try to recover. Obviously, the only one that recovered was after antibiotics. Since my mom is a psychologist, so she has something to say about the suicidal thought, because there is a high prevalence of this type of thoughts in the patients, and she explains it for the type of situation the patient lives. The absence of information about Lyme, the lack of specialists, the lack of diagnosis tool and medical care reported in this study says that iatrogenic medical response, medical neglect and confusion, loneliness and lack of compassion makes the patients feel trapped between the physical suffering caused by the disease and the doctor's response that there is nothing, or that it is all in the head. This type of situation is called impasse. It represents a deadlock in the psyche of the person, and impasse situations are often associated to suicidal thought and suicide. However, the hypothesis is that the high incidence of this symptom is primarily due to the deadlock generated by the patient's relationship with the medical environment. A correct bioethical behavior can prevent the impasse. So before interpreting suicidal ideation as a consequence of the damage that Borrelia produce or can produce in the brain, we need to investigate the patient's relationship with the medical environment. Last thing is the map. So this is just a map. The first map of cases we see, especially in the north, these are our 42 patients, and most of them are in the region of Buenos Aires, because Buenos Aires is Buenos Aires area is the most populated area in the country. 1/3 of the population lives here. That's why it's normal to find more people here. And we find people in Rosario still. Rosario was one of the places, in very important places. In this map, I am showing more or less the same people, but in this case, the places where they were bitten by the tick, and the black points are the places where research has shown Borrelia, even in birds, animals, ticks, and humans. So we have research around this area, we have research in this area, and we have people bitten here, and also in Buenos Aires, and obviously also in Rosario. So the conclusion is that there is indigenous and non-indigenous cases of Lyme in multiple regions of Argentina. So therefore, the position of Argentine health authorities who deny the reality is erroneous. And furthermore, it demonstrates that the national health system does not detect and is not prepared to treat Lyme cases, since 100% of the patients report having difficulty finding the doctor, and only 44% of the cases were diagnosed locally by doctors who have already passed away. Here in the picture, we put pictures of Argentina, and they are not just tourist promotion. They are places where we found ticks. Okay. What we learned that there is Lyme disease in Argentina. It's always difficult to find a doctor. And the impact is important, because in this work, we are recognizing the patient's point of view, and we believe in them, we listen to them. Some of them will listen to this presentation, and this create an important emotional impact. And also we hope that there is a result with force Argentinian authorities to reconsider their position. Acknowledgement. Thank you for Lyme patients in Argentina that are working, even they are very ill, so they are working for other people to make it possible for other people to know about the disease and not get that ill as they are. Anabel Vidal, in particular, she did the maps. Giusto Trevisan, which is an Italian specialist and professor, has helped us a lot with detection and with information, and he diagnosed my mom. Leona Hilbert, thank you very much for every opportunity. And Nestor Stanchi, which is our counterpart in Argentina, he did much of the research on patients, and I did the presentation. Okay, these are the pictures and reference.
What is the next step forward for you guys? Because it's not recognized. What's the strategy?
Well, we have a couple of strategies. ¿Quieres responder vos? ¿Cuál es la estrategia? ¿Qué vamos a hacer ahora?
¿Qué vamos a hacer ahora? Bueno, decirlo.
Okay, I say that. So we are trying to promote this space and to make public information about Lyme the way we can, through social media, through patients. We have been doing, my mom has been doing lessons in universities, lessons in different parts of the country, interviews with media. And also we are working with Professor Trevisan with the laboratory in Trieste to promote the research. It's not easy to promote research in humans, but we are working with tick project and a project on mouse. And she would say, yeah, it's a project with we found mouse. There's a research that found ill mouses, And so we really want to follow up with that and try, because they are in the city. It's a big city. So. Okay, thank you very much. Yes.
I was just going to ask, do you think this is the case in a lot of South America? Do you think other countries, Venezuela and so on, have the same problem?
En Venezuela,
Sí, si crees que este es un problema que tienen otros países de América Latina. Yes, all of them. Probably all of them. Venezuela is quite far away from us, but for sure Brazil, they have a specific. For sure Uruguay, we have a research showing Borrelia in Uruguay. Brazil, we have Borrelia in Brazil. So yes.
It's interesting though, because there's a particular line of products called Nutramedics, and they are from the Amazon, a lot of them. And Dr. Lee Cowden, who flew there and found them from the tribes there, must have had some connection between Borrelia and co-infections and these remedies to have identified that they were the correct ones to use.
Probably.
So that'd be interesting to sort of dig up that story and find out more about it.
The problem in Latin America is research. And in the last years, the last period, when research criteria, methodology criteria had been more strict, it's difficult to publish. And so it's always more difficult to produce research.
En Brasil, el doctor Yosinari había terminado su doctorado con STIR en Estados Unidos, y cuando él llega a Brasil, el gobierno le habilita un consultorio a la Universidad de San Pablo, y entonces logran hacer esa investigación sobre el Valle Yosinari síndrome, con como 30.000 pacientes, 28.000 creo, y 30 años de investigación. En los otros lugares no hay investigación de investigación. En Brasil se encontró también Borrelia Lyme.
So in Brazil was possible the research because Dr. Yosinari has worked with doctors here in the United States. So he came back to Brazil after his PhD. He brought reactives, and he started his medical activity, and he started testing his patients. So yeah, he did a incredible research last 30 years, and but when that ends, it's difficult to continue. It was very difficult to continue. Also the number of research.
In Brazil, and years ago, there was Lyme syndrome, the Sergio Yosinari syndrome. They still started it, but they couldn't isolate them completely. Progress in the identification of the bacteria.
Te pregunto si los de Valle Yosinari syndrome no pudieron cultivarla.
No pudieron cultivarla.
Y si eso continúa, si la investigación continúa.
No lo sé, porque Valle Yosinari murió de COVID hace 2 o 3 años y no me pude contactar ni con su secretaria.
We tried to contact Yosinari, the team. Yosinari fue el que murió hace...
Sí, falleció de...
He was there.
Yosinari died of COVID. Yeah. And well, we will be trying to, she tried to contact the team. She still didn't succeed, but we will not. We will try to keep on that, follow with that.